Hi, this is a demonstration on how to prime IV tubing. This is not intended to be a study guide for your lab testing. For questions regarding lab testing, please refer to your critical elements. So today we're going to change the IV bag that's already hanging, spike a new one, and set the drip rate. So the supplies that we need for this procedure are, we need an IV bag, make sure that it's the right solution in the right amount. We need primary tubing. We need tape. We need gloves, clean gloves. And we already have an IV established, so we just need to make sure that's running okay, which we'll talk about in a minute. So the first thing that we do is we go and grab our IV bag. So I have my bag of normal saline, and I checked it against the orders to make sure that it's the right amount and the right solution. I'm going to wash my hands. I'm going to explain to the patient what we're doing and answer any questions that we have. Then we're going to open up our primary IV tubing. First thing that we're going to do is close the roller clamp. This is the end that's going to go into the IV bag. The cover pulls off. This is the end that's going to go into the IV itself. This right here is called the drip chamber. This is where you're going to see the fluid drip down in here. Grab your IV bag, pull off the cap, remove the cover, and insert it into the tubing, or to the bag. Hang it on the pole. Now, the drip chamber here, we're going to squeeze 2 times or until it's half full, whatever comes first. So 1, 2, and that's pretty good. If you overfill this, you're not going to be able to count the drips. Excuse me. Okay, now this tubing is filled with air. We need to replace the air with the fluid that's in here. So what you can do is you can take the bag that the tubing came out of, hold it in here like so, and then you're going to slowly open up your chamber until it starts dripping. Now you're going to follow the fluid as it goes down, and when it starts dripping into the bag, you're going to turn it off. Okay, like so. Now I need to go back and make sure there's no air bubbles. There is a bubble here that we're going to have to get rid of, and I'm just going to go back and look on the other places to make sure that's the only one that we have. Pay particular attention to these caps here. Bubbles love to get trapped in there. There's no bubble in there, and there is a little bubble in here. So what I'm going to do is take my tubing again. I'm going to open this up, and I'm going to give it a little flick. That little flicking is going to remove the bubble, and then I'm going to run it out again. Once the bubble goes away, you close your roller clamp, and then you're good to go. Now, this cap on the end, do not take it off. It will flow with the cap on it. If you take this cap off and you drop it on the floor, you've broken sterile technique and you have to start all over again. So don't remove this cap until you're just about ready to plug it into the patient. All right. So hang this on the pole now. Now what I'm going to do is I'm going to get a pair of gloves, clean gloves, and put them on. And then I'm going to assess the site for any redness, edema, swelling, infiltration, phlebitis, anything like that. So I'm assessing it, and there's none there. Everything looks okay. So now I'm going to remove my gloves, and I'm going to turn off the IV that's running. I'm going to disconnect the IV, and then I'm going to get rid of it, so I don't get it mixed up with the other bag. Okay, so now I'm going to take my tubing. I'm going to take an alcohol pad, which I have here, and I'm going to clean the port. Remove the cover, insert it into the IV, and then screw it in. Now I'm ready to count the drips. This takes a lot of practice. You're going to remove this roller clamp up and down and see it drip. If you want 20 drops in a minute,
you need to count it out for a full minute. There are some tricks that we can talk about in class on how to make this a little bit easier, but for here, just know that you have to count whatever amount of drips in that minute is going to be. So when I find the number that I want, which is 20, I'm going to drop it, and then I'm going to count it again for a full minute to make sure that I'm in the right spot. Now I have everything running, everything's running good. I can go back and I can time my bag now. So I'm going to take a piece of tape, and I'm going to write my name, or my initials, the time, and the date on here. So that way the next person that comes by knows when I started this IV. I'm going to put this right on the tubing. Okay, that is an example on how to do a primary IV. Thank you.